That kind of sounds like a heart beating, that music there. You are tuned to Talk Erie and the Joel Natale Show, live from our Kingdom Financial Group studio here at 5th and State. And we are excited to have the crucial conversations that Erie needs with Gina Klofft. She is from the American Heart Association for American Heart Month. Gina, great to see you. So appreciate you coming on.
Thank you for having me. I love being here, especially during Heart Month.
This is the time to come. Give us an idea of what this past year has been like for the Heart Association and for your efforts here locally.
Well, thank you. Our mission is busier than ever, right? The work that we're doing is critical. There is a great need. Post-pandemic, Joel, a lot of health issues, right, are under spotlight, significant ones, right? Heart disease, stroke, diabetes, obesity, unfortunately, things like smoking, right, and vaping and e-cigarettes, they're on the rise. So the work that we do alongside our sponsors and our volunteers, our board members, the community is really important. But I'm excited because we've been able to partner with some Erie giants, right, that care very deeply about our mission. One example we can talk about is Lecom Health and their commitment to rural health, right? Thanks to Dr. Casey Becker, who chaired the Heart Ball last year and did a brilliant job. He brought this incredible relationship to us, and we're investing alongside Lecom Health in communities like Corey, Wattsburg, and Union City. And I couldn't be more proud of that, Joel, because I'm a Wattsburg native.
Right.
I'm a rural girl. So really, really excited about that. And that's a multi-year investment in the work that we'll do. And that will evolve over the next few years. But really, really proud of our community for stepping up always for our mission.
Yeah, the key here is that access, in the rural area. I'm thinking about probably when you were growing up, visiting the doctor was 15, 20 miles, right?
It still is a challenge. There are so many challenges in rural communities, right? Access to care, right? Transportation, access to healthy and fresh foods, right? There aren't grocery stores. A lot of people, if they don't have transportation, they don't have the resources, to get to those doctor's offices, those appointments, and then, of course, a big focus as well as mental well-being, right? And helping individuals manage stress, all kinds of stress, so that they can make their health a priority.
I think when you've been here in the past, we have talked about kind of the, there's the main primary indicators of heart disease. And then there's these things like mental health and stress and things that can really be triggers. Can you remind us about all that? Yeah,
it's part of our life's essential 8, and it's a really good point. So we have the controllable versus the non-controllable risk factors, right? So the non-controllables, obviously, things like our family history, our age, our sex, female versus male. Number one killer of women over the age of 25. 1 of 3 women die, Joel, from some form of cardiovascular disease. So if you're a woman, right, there are things that you need to do. Those controllable risk factors are more lifestyle related, right? Avoiding tobacco, moving more, eating healthy, certainly seeing your doctor on a regular basis, staying on your medications, managing stress. All of those things are things that we can do, and we look at as an investment in our health.
Right. Yeah.
Our heart and brain health, by the way, Joel, because in Erie and Northwest Pennsylvania, stroke is the number 4 killer and the number 1 disabler.
Yeah. The whole thing with stroke is one of those things that all of us know somebody either in our family or in our friend group that has either gone through a stroke or an aneurysm, and it's all tied to all this.
I'm really excited this year because brain health and the investment in the education and the resources for our community is going to be heightened because of our leader, Dave Markowitz, our fearless leader from Encompass Health Rehabilitation Hospital of Erie, is chairing the Heart Walk, Joel, on September 10th. And launching in May, we're going to do an incredible brain health campaign, not only to make folks aware of the warning signs of stroke and, those compelling statistics, but also empowering them with resources, right? So through employers, so community centers, centers, through churches, and through schools. We'll be doing a lot of incredible work in that space. And it's been a while. I'm pretty excited about it because we always focus so much on cardiovascular health, which we will do, by the way. We will continue to do with our friend Dr. Paul Kang, who's chairing the Heart Ball on June 2nd. Or June 5th, I'm sorry. June 5th is a Heart Ball with Dr. King. So, there's two great leaders. They're going to focus on two of Erie's largest killers. And with them, we're going to save many lives.
Talk about if do we have outcomes here in Erie that are higher than we should? Like, is there something about being in the north, being in the snow, our socioeconomic levels that are causing more issues?
Yeah, there are definitely barriers here. We have that porous zip code, that many of us are trying to address the needs of those communities. Certainly those social determinants of health are a key indicator in really great collaborations. I'm so proud of many of our, not only our sponsor collaborations, but, our collaborations with like Second Harvest Food Bank and the JFK Center, Martin Luther King Center, the Department of Health. Like, we need strong leaders that have the same vision for helping us overcome these challenges. And there are many. Obesity is a big issue, a lot of sedentary, particularly youth. In our community, the incidence of smoking, vaping, e-cigarette use is higher here in other parts of the country. And for stroke moving nationally to number 4, it's been number 4 here for some time. So things like hypertension control, those 30 million people that are living with high blood pressure in our country, helping them get the resources they need to improve their numbers.
Well, and I don't want to get political with you, but I'm worried that, during COVID, one of the things we were really worried about was people were avoiding their screenings. Are we still reaping the downside of all of that?
It's absolutely an indicator. And that's why I am so excited about our work with LECOM Health, right? They see the importance and the significance of focusing on rural health. So we're actually doing this fantastic campaign called You Are Not Alone. We've invested in billboards alongside LECOM Health. We're working with some churches in the community, and we're going to provide, sort of an online resource for people to drive them to take an action. What is that action? Seeing their physician, getting their blood pressure taken, getting an at-home device where they can measure their blood pressure. Whatever action it might be will drive them towards a clinic, perhaps in a rural environment, where they can invest in their health, because knowledge is power, Joel. So if they know now in their 20s, 30s, 40s that they, their numbers are creeping up, there are ways that we can control them, right? Through diet, exercise, and lifestyle changes.
You were mentioning the youth. How much are schools able to be a partner in all of this?
Oh my gosh, we love our school partners. So we actually have a youth engagement director. We have a program in the schools right now. Emma does a great job. She's got many counties, including Erie, and we're in the schools doing some really neat things. Number one, we're teaching kids, early on about moving more and avoiding things like fast food and tobacco, right? But we're also teaching them to give back, and I love that, right? I think that next generation of volunteers that are invested not only in their own health but in each other is a really beautiful way to bring our work to life in the school setting.
And so keeping them moving, maybe having competitions or whatever, does that help? Is that what's going on?
Oh my gosh, we do it through school assemblies.
Okay.
There are challenges for them. There's incentives, but also their administration gets involved. So they've done some fun things with the principals, like pie in the face,
Okay.
the kid that raises the most money or moves the most. There's some really neat ways to get these kids excited and make it fun for them during the school day as well.
You mentioned the food aspect, and again, there's a lot of talk about ultra processed foods and things. What are you hearing about that? The kind of the real food craze kind of thing.
Yeah,
Yeah.
so the American Heart Association, as you can imagine, Joel, has a very strong position on, a diet and what dieting looks like, or a healthy diet specifically. Everything that we do is based on science. And that's one thing I love about our organization. So, we aren't into fads, or, a lot of the things that you might see online. We truly want a balanced diet, right? A balanced diet, with a colorful plate. The more colorful your plate, the healthier it is. But we also want you to take other actions, right? We want you moving more. We want you to manage your risk factors, including your blood pressure, your BMI, body mass index, fasting glucose, cholesterol. We want you to talk about your family history, right? But all of those things become part of that knowledge is power piece. So if you know perhaps that you are at a higher risk based on your family history, and you're taking certain actions through a healthy diet, a healthy balanced diet, right, it can reduce your risk.
Yeah, what I mean, it's hard for adults to do this, and then make sure that kids don't fall into the obesity trap has got to be
it's a slippery slope, right? Because there isn't really a good balance within the schools yet. So, we like to have it start at home, right? When we talk about being a good role model at home, moving more, maybe taking a walk with your family after dinner, cutting back on your sweets, all of those things can start at home. There are so many resources on our website at heart.org, including thousands of free delicious recipes. But I would just say, to be cautious, but work alongside your healthcare professional when you're thinking about a fad diet or any recommendations that don't align with a balanced healthy diet.
Yeah, under the Eat Smart thing here, it says everyone can experience joy in food, all in a way that's delicious, doable, healthy, and affordable.
That's right.
And so, yeah, that sounds like.
Do you have a garden, Joel?
You know what? My wife has. We do garlic and some tomatoes and things like that.
That's good. I mean, gardening is good, and that's another way to get the kids involved, right? At an early age, encourage them, to plant seeds and enjoy the fruits of their labor, for lack of a better way to put it. So, if you have an opportunity to grow some tomato plants or other, options, that whole foods, are always a better option, but it also saves you money in the long run.
Oh yeah, it was astounding how many cherry tomatoes we got, like 1,000 of them from just a few plants.
They're my favorite.
Just keep picking them, right? We're talking to Gina Klofft. We're going to take our first break here. It's Talk Erie at 4:19. it's National or American Heart Month here in February. Of course it would be, right? It's Gina Klofft is with us here from the American Heart Association here. And we were talking about supporting our kids, especially when they do cool things. So tell the story that you have there.
Yeah, so Joel, we're really excited. We're in the second year of a national blind campaign called Teen of Impact. It's an American Heart Association initiative that, gets youth involved. They're typically in their mid to late teens. They care about our mission, care about making a difference in the world, and they step up with their friends, right? So they recruit a group of friends, and they over a several week campaign. It launches on National Wear Red Day, February 6th, and ends April 9th. And they get points, Joel, for different educational activities that they do, as well as their fundraising. So it's a really cool campaign. Kate and Ayat are the two young ladies from two different well-known schools in our community. And with their teams, they have chosen an area of focus. This year, it's women's health. And I love that because I think so many young women in their teens really struggle with, figuring out how to manage their mental health, the stress, the pressure, eating right, all of the things that come with being a young lady in today's society. So I'm really proud of these two young women for stepping up. They're fundraising, they're doing education, they're finding creative ways. They're using things like TikTok that this old girl doesn't really use, but they use it as a tool, right? As a good tool, right?
Yeah.
To send positive messages into the community that will reach so many youth. I couldn't be more excited. They have a pretty aggressive goal. Last year, Sheen did our Nation of Lifesavers campaign and raised just about $30,000 for AEDs and CPR training. We're getting ready to place our first AED in the Erie School District because of her work.
That's fantastic.
I'm really proud of these kids. And as the mother of three daughters, I recognize the challenges, right, for young females. And so I think this is a really positive thing that will continue for years.
I think you've taught us that the big misnomer is the idea that heart health or heart attacks is a man's deal, whereas women really have to be careful here. And that's what the whole Go Wear Red Day is all about.
That's
right?
exactly right. So sadly, heart disease is the number one killer of women over the age of 25. A woman dies every minute in this country, Joel. 1 of 3 women will die from some form of cardiovascular disease. That's more than all types of cancer combined, right? And there is a misconception about that, but a few things are happening, right? I know a lot of female survivors that thankfully survived. I sadly have lost some close people to me, including a coworker at the age of 34 who died on my birthday in the year 2000. And I dedicate my life work to her. Her name was Karen. She was from Wesleyville. But what is happening are two things, really. Is number one, women aren't recognizing or are ignoring early warning signs. Oftentimes for women, the warning signs look different from men. They don't have that movie, that classic movie symptom of that pressure in the chest.
Right, the
sometimes
elephant.
they do.
Yeah.
Sometimes they do, but oftentimes they don't. For many of the surviving women that I've talked to, especially the young women, it was the extreme fatigue, or I feel something's off, or maybe I'm getting sick, right? So they're not oftentimes recognizing that. Now, of course, every time we get sick, we're not calling 911,
Right.
but we want you to look at the big picture, right? A family history, number one. Are you a smoker, or were you a smoker? Are you managing your numbers, your blood pressure? Are you on the medications that you need to be on? Are you moving more? Are you eating healthy? And if you're looking at that big picture and recognizing that, hey, I've got some family history and I have high blood pressure, but I'm not on medicine. And now all of a sudden, I've got this extreme fatigue. And we're talking so extreme that a week ago you could run up this set of stairs, and today you can barely get up the steps without stopping to take a breath. This is the extreme fatigue we're talking about. And we hear that about in men as well, particularly middle-aged men, executives, that sadly we've lost in this community, that you hear the stories that there were early indicators.
I mean, are these over like periods of days and maybe even weeks?
Yeah,
like
it depends.
it kind of creeps up on you.
That's the tricky part about cardiovascular disease, is that it is different for everyone. That's why we want you to see your doctor on a regular basis. We want you to talk about your family history, and we certainly want you to pay attention to the warning signs that your body is sending you. There are oftentimes early indicators that we dismiss, and I think across the board that's why we're the number one killer, and on average, Joel, 6 people dying every day in our community right here in Erie.
Yeah, education. I mean, again, that's what
knowledge is power, my friend.
that is what you do. The part and parcel of what you do here. But it is alarming to think that with all the technology and all the things we have, this is still like this big surprise. That you don't know what your numbers are. You don't know what your hypertension is, and so on.
We've come a long way. When I started in 1986, 40 years ago, at the Heart Association, we didn't have the technology and the treatments and the medications that we do today. We've come a long way, baby. Yeah. But we've got a long way to go because, unfortunately, people aren't taking the action. They're not investing in their own health. And those preventable risk factors that we talked about is really the investment piece, right? And early investment, not waiting to be reactive, but being proactive in your health in your teens, 20s, 30s, and beyond. There is some science that says that if you're taking actions now, those investments will help you live longer.
Is it appropriate to have a conversation with your parents or so on to find out how Uncle Fred passed away? I heard Uncle Fred died at 53. What was that all about? A lot of folks don't know their family history.
That's right. We do encourage it. When we're out in the community or at businesses, we do encourage people, asking the questions, finding out, discussing that with their healthcare professional. What I found, though, is some interesting things when people have either been adopted or they don't have a relationship with their family. There are some challenges there, but we still have science. We still have those indicators through our biometrics, right? Okay. Our blood pressure, our cholesterol, fasting glucose, BMI, that can really help pinpoint what some of those early, things that could be indicators, right, of cardiovascular disease.
Does the Heart Association suggest that annual screening with your PCP
we should always be seeing the doctor once a year, Joel. Sadly, many people in our community, specifically in rural health settings, are not seeing a physician. We've noticed a big downturn post-pandemic, right? Which is why I am so happy and proud about our relationship with LECOM, because their work alongside us, they're making this investment to drive more people to take an action, and that's ultimately going to save lives.
Yeah. Gina Klofft is with us here. We are talking about American Heart Month. We got to take our bottom of the hour news break. Stay with us. It's Talk Erie. Appreciate you tuning in to Talk Erie and the Joel Natale Show, live from our Kingdom Financial Group studio. Also live on Facebook and on YouTube. Gina Klofft is with us here, American Heart Association, right here in Erie and in Crawford and in Warren. How many different counties did you just mention here?
Just a few. I mean, I spend most of my time in Erie, Joel, but I am responsible for Crawford, Warren, a little touch of Chautauqua County, and then all of central Pennsylvania.
Wow.
And we do this just with a strong team of volunteers here in Erie. We have a very diverse and caring set of board members who keep me accountable. They keep me in line, and they help us really hone in on our priorities for the community. We use the community needs health assessments from the local hospitals, the Erie Community Foundation, as well as the Erie County Department of Health, and we reevaluate every 3 years how we reinvest our dollars here. So yes, we're always going to be focused on research, but there is a certain percentage of the dollars that we raise through the Heart Walk and Heart Ball that come back right here to the community, and I'm really proud of that.
Well, I love that you mentioned how this is a data-driven endeavor, that you're using the community needs assessment, because that does alter from time to time, right?
It sure does, but sadly, as long as I've been around doing this, cardiovascular disease and stroke stay up at the top, right? In terms of priorities. So it's great to partner with UPMC Ham and Allegheny Health Network, St. Vincent, and LECOM, of course, to sort of, stand down on, what are the priorities? How can we work collaboratively to meet the needs of those who need us the most?
Are we seeing any technology or, outcomes that are, we have these, like you said, these three amazing networks, and if you have that heart attack or you have that situation, are we getting better outcomes post?
We are, and I'm so glad you asked, because we have a program which I love to call affectionately our Perfect Patient Care Award system here. It's called Get With the Guidelines, Joel. And without getting too much into the weeds, it basically is a best practice set of guidelines based on science from the American Heart and Stroke Association. So once a patient is picked up in an ambulance and ends up at the emergency room, and through their entire journey at the hospital, and ultimately and hopefully when they leave the hospital and go home, there is a set of behind the scenes recommendations from the American Heart Association in what I call perfect patient care. The good news is our hospitals here are at the highest standards of that care. So we are regularly awarding them at the silver, gold, and gold plus recognitions. And that's something that we should never take for granted. So that means things like door to balloon time when you're talking about needing a cardiac catheterization, right? It's fast. It's incredibly fast, and it's at the national, recommendations. So
door to balloon?
Yeah.
Is that when you get your stent?
That's exactly right. That's what we call door to balloon time. And our local hospitals measure their success, on how quickly they evaluate and get a patient, onto the table and have one of our many talented medical professionals treat them. It's a really excellent program that it's really the way that we thank them publicly for saving so many patients and treating them, with all of the science and resources that are available through our mission.
I want you to go over your 5 pillars, because again, this is kind of what drives you, right?
Yes. So when we talk about, the local board of directors and even the national piece, how does it all trickle down and benefit our community? So nationally, when they look at how do we take all of the important priorities and sort of, filter them down to the key metrics that will help us save lives, they came out with these 5 health pillars. And at the center, if you imagine, of these priorities, Joel, is equity, right? So we want everyone to have things like access to care, right? Access to healthy and fresh fruits and vegetables, all those things. But around the 5 pillars, Number one is women's health. And we talked about that, right? So that will always remain a priority for the American Heart Association. And it's why I love, National Go Red Day and all the work that we do throughout the year, but especially in Heart Month around women's health. Number two is Nation of Lifesavers. You remember when Damar Hamlin went down on the field and the, best practice use of an AED and hands-only CPR saved his life, right? We really have honed in on that, and we've set a really aggressive priority to have one person in every household in the United States trained in hands-only CPR. CPR saves lives.
So let's unpack that a second there.
Yeah.
If I wanted to sign up for a CPR refresher, because I haven't done one since high school, how would I go about to do that?
Great question. And so there are different needs in our community, and I want to make sure we differentiate that. If you're a healthcare professional or your employer requires you to actually be certified in CPR, that's something different, right? And that would be through our community training center, Emergicare. I'm about to give them a big award here in a couple of weeks for their great care in our community. But that is a certification. What we are talking about is changing a nation of bystanders into a nation of lifesavers. This means that everyone can be the first responder. What does that mean? It means knowing the basic, procedures regarding hands-only CPR. As you may recall, we did away for the layperson, the mouth-to-mouth, right? And now it's that hands-only CPR, and there's some incredible and fun ways to learn it. In fact, I just heard today that Bad Bunny's, one of his popular songs, is the exact beat that we need to keep a person alive till first responders arrive on the scene. So we want you to learn CPR. And one of the cool things, the Heart Walk this year, is when you register for the Heart Walk online, you get a free video which will allow you to learn hands-only CPR digitally, right? Of course, if you need to have physical hands-on training, Emergicare can help with that. We're having gifts of CPR kits at local community centers. Wegmans just kindly donated some kits to all of our community centers last year, and the Mill Creek Youth Athletic Association. So those kits are available as well for training. But at the end of the day, most people don't have access to that, and most people live on their phones or their laptops, right? So we wanted to make it easy for more people to learn CPR. And so they can visit heart.org and just type in, hands-only CPR in the search engine, and they'll easily access that link, or they can walk with us on September 10th and learn it there as well.
I think it's funny that you're promoting the Bad Bunny song, because the original song was "Staying Alive" by the Bee Gees, but that is 50 years old.
My generation, perhaps your generation, loves that, but these, we want to engage the next generation of lifesavers, right?
Yeah.
And so we recognize that we have to have Taylor Swift and Bad Bunny and Miley Cyrus and all those, songs that this next generation will find fun and appealing to learn this life-saving skill.
Awesome. What's so we had women's health, National Lifesavers.
Nation of Lifesavers, right? Next is tobacco prevention. So I know I've been here before to talk about it, Joel, but we're talking about a huge epidemic with youth using vaping and e-cigarette tools, and really a sad situation. So
see, I thought that was kind of fading away. It hasn't.
Unfortunately not. No. So nationally, adult cigarette use is down some 49%, and big tobacco saw this coming years ago, and so they, of course, with all their wealth and their influence, were able to, come up with this idea of e-cigarettes and vaping to sort of hook this next generation. And it is hard for me to see. I see it a lot in Erie. We do have a higher percentage of adult smoking here as well, which is why stroke and cardiovascular disease continue to be a problem here. But we're doing a lot of early intervention with young people now, as at the elementary school level, in middle schools. We recognize education at those levels are critical. And their young little minds are like sponges, right? So we're really trying to get in front of it and be proactive rather than reactive, waiting till later in life, right?
Explain what the big negative to vaping and e-cigarettes.
Yeah, I mean, listen, there's a couple of them, right? I'm not the expert like our awesome community impact director, Brandy, is, but I will tell you this, this is sort of a gateway, right?
Okay.
A gateway to tobacco. And unfortunately, a lot of youth are putting other things in these tools, illegal drugs and other things that are just ultimately not good for their heart and brain health. And the long-term detriment, it's a lot like using energy drinks, right? Like the long-term effects of using them it's not going to be good. And so we're doing everything in our power alongside other organizations like the Lung Association to educate youth now, right? Okay. We've got an uphill battle. Big Tobacco has a lot more money than we do, Joel, unfortunately. So they have a lot more resources and they have a leg up on this with us, but we're gonna win.
This is gonna sound okay, so I'll take it. I'll take the hit, but I am always flabbergasted at seeing highly educated professionals tugging on a vape. It's like, dude, don't you know what that's doing to you?
Yeah.
And I'm just gonna leave it there, but
yeah. It happens across, there was a marketing campaign that came out early on from Big Tobacco back when they were giving away vapes and e-cigarettes at concerts. I saw it myself when I was in the concert part of my life. And, we've been able to enact legislation with local caring leaders who are trying to protect our youth, but they got a head start on us.
Yeah. Yeah.
They got some of these kids addicted. Next pillar of health is what we call patient care. That's around hypertension, blood pressure management, knowing your numbers, taking your blood pressure, staying on your medication.
So you really think that having a cuff at home is a helpful thing?
Absolutely. Everyone should be able to self-measure at home, especially as we age gracefully, Joel, because our numbers, maybe in our 20s and 30s, our numbers looked really great. And as we age, our numbers start to creep up. And so we want to be able to self-measure, especially if there's family history or we already know that we have hypertension. We need to monitor it, take it at the same time every day, use our best practices to make sure you're getting the most accurate reading.
Wow. One more real
quick here. We have my favorite, if I'm allowed to have one, healthy living. So under healthy living, Joel, is two really important things that I think are critically important to moving the needle to health in Erie, and that is mental well-being and nutrition security. Joel, there are 28 food deserts in Erie, and we want the healthy choice to be the easy choice in our community, and right now we're not there. We're not even close. If you walk into any convenience store, and I'm not going to pick on any, but if you walk in, the healthy choice is not the easy choice there, right? So we've got a long way to go. We're working with local partners like the Department of Health to make sure that there is access to food. And then the mental well-being toolkits, access to stress management tools. We work with a lot of companies, the top 25 employers as well, to try to help give them resources for their employees, particularly through wellness committees.
Oh, what does that look like, a wellness committee?
Oh my gosh, well, everyone's a little bit different, but I might use an example of the Erie Federal Credit Union. Okay. They really did a very organic committee. They consulted with us. They did their own research on other company committees, and they evolved as this wonderful best practice example where they're incentivizing their employees, they're rewarding them for healthy behaviors, they're a smoke-free campus. They really are committed to making sure that their company, they're healthy, right?
Yeah.
Their vending machines, their smoking policies, and everything that they do, they're leading by example. And I think it's really made a difference there for their employees. And this next generation of employees is looking to work for employers that have healthy options, right?
Yeah.
So we want the most expensive thing in the vending machine to be that bag of chips and the cheapest thing to be that apple, right? By design, we want people to be able to drive people to make that healthy decision.
Those investments in wellness now pays dividends for lost wages and work, and retention and all that stuff.
A healthy
right?
workforce is a productive workforce, and ultimately that means they're coming to work every day, they're more productive, and that truly does affect the bottom line of the company as well. So we'd be really interested to work with any employers here to help them better understand our resources and be able to provide their employees with all the things that need to live a long, strong, healthy life.
All right, we got a couple minutes left with Gina here, and I want you to hit the big pillars of the Heart Walk and the Heart Ball, because people need to know how they can get involved.
Yes, thank you. We always need support financially. No money, no mission, Joel, right?
Yep, yeah.
So my job as a fundraiser is to make folks aware of opportunities to get involved. And listen, if they don't have the financial resources, they can maybe come and volunteer, right? There's lots of opportunity there as well. So on Friday, June 5th, at the Ambassador, Dr. Paul Kang from UPMC Hammett is chairing the Heart Ball. He's doing a really fun tropical theme this year. He has a wonderful committee of family and friends and coworkers that is going to put on one super fun party where we'll celebrate all of our mission wins and raise lots of money. We have a Heart Hero story, and it's just a really beautiful campaign where my daughters call it prom for adults, but then we get to dress up and celebrate the mission of our organization. And then September 10th, it's a Thursday evening at Liberty Park, or should I say Rebich Investments Amphitheater at Liberty Park. I got you, Todd.
There you go.
We are having the Heart Walk, and Dave Markowitz, the CEO of Encompass Health Rehabilitation Hospital of Erie, is chairing that campaign. And I've never been more excited about these two leaders. I absolutely adore them both. They're really excited. They're really engaged. So, if nothing else, come out and do a Heart Walk team with us, sponsor a tent, get involved, find ways to stay involved, and keep your employees healthy.
How do you get the team together, or even just generate your own?
So the team is heart.org/Erie Walk. Okay. Or just search on your app, your Heart Walk app on your phone, Erie Heart Walk 2026.
Okay.
And it should come right up. And then the Heart Ball is by invitation only. That's a sponsorship opportunity, but we're always looking for sponsors and or volunteers.
Fantastic. Gina, always a pleasure to talk.
Thank you so much.
To celebrate Heart Month. And we're in this town together. One of our imperatives is to love our neighbors, right? And so loving our neighbors is to keep each other healthy, and this is what we need to do.
Yeah,
right?
I love this community. This is a very generous and caring community. I've always been a huge fan of Erie and all the things about Erie, even the winter. We have to embrace the winter as much as we can. But, I think you're right. It's about looking out for friends, family, coworkers, but most importantly, looking out for yourself, making sure that you're seeing your doctor, that you're, managing your numbers, eating healthy, managing stress, and getting enough rest.
You got to do it. Again, it's National American Heart Month. Gina Klofft from the American Heart Association. Thank you so much.
Thank you.